Hi, everyone. I'm Dr. Sarah Cate. I'm the Chief of Breast Surgery at Stamford Health, and we're celebrating Breast Reconstruction Awareness Day with some of our amazing patients and amazing plastic surgeons at Stamford Health. I'm honored to be joined by two of my colleagues and one of our patients, and we'll just go around the virtual platform and introduce ourselves now.
So I guess I'll go first. Hi, I'm Tomer Avraham. I'm a plastic surgeon focusing in breast reconstruction. I've been in practice in the Connecticut area for about 7 years now, previously a little further down the shore, and now here in Fairfield County at Stamford Hospital. And I'm looking forward today to meeting with our lovely patient who's so generously given of her time to share her experience.
Hi everyone, I'm Jordan Jacobs. I'm also a plastic and reconstructive surgeon. I've been fortunate to know Tomer for almost 2 decades. And I also operate at Stamford Hospital and work closely with Dr. Avraham on many of the autologous reconstructions, which we're going to be discussing today.
Hi, I'm Olivia. I'm a mother of 3 living in Connecticut who just went through a diagnosis of DCIS with bilateral mastectomy, reconstruction, all the great stuff that we'll talk about on this today, and just happy to sort of share my experience for those that find it helpful for them going through their own journey.
Great, thank you so much. So tell us a little bit, Olivia, when we talk about autologous reconstruction, just for clarification, we mean tissue from one's own body. So tell us exactly why you chose that type of reconstruction.
Sure, it's actually an option that I didn't really know existed until I spoke and met with Dr. Avraham. I have had friends who have gone through, similar diagnoses who have all gone the route of implants if they did a mastectomy or bilateral mastectomy. So it was interesting to me, and I think it's something that when I was kind of given the options by Dr. Avraham, who by the way was just spectacular in sort of understanding the emotional experience of having that first conversation and being a little bit like, what's right about a situation that doesn't really feel like a right choice. And I think just given my age and the fact that when I kind of had all the information on the table, it was truly just something that felt right for me. I didn't necessarily love the idea of having implants or something that I would have to maintain over time, especially again, just given my age, which I'll pretend that I'm young in my 40s. And so I didn't really, I don't know, it just felt like that was the right way for me and something that was a little bit more natural. And there's really nothing else behind it other than you kind of have to go with your gut and your instincts on these things. And I definitely had some doubts, I think, in terms of the recovery specifically. And I remember mentioning that to Dr. Avraham in a meeting before the surgery, and then was just like, I'm going to stick with what my initial instincts were and how I want to approach this. So, but really was truly not aware of this type of reconstruction rather before going through it myself. So was sort of grateful that there was a couple options.
Absolutely. And then Dr. Avraham, maybe you can comment a little bit on who's eligible for autologous reconstruction and some of the benefits of it.
Yeah, so, I very vividly remember meeting with you for the first time. And I remember walking into the room and, just meeting you and thinking in my head that you were very likely going to have an implant reconstruction, just based on the fact that you're such a slight woman. And, when we use tissue, we're using extra tissue, and you're not somebody that has a ton of extra tissue to use. And when I spoke with you, it became pretty clear that you just did not like the idea of an implant. And I think that's completely understandable. There's a ton of things that may be unpalatable to certain patients about implant reconstruction. And so we were able to come up with an idea for how to use tissue in a way that is slightly less typical than most of the cases that we do. Is it okay if I discuss the specifics of your case?
Yeah, sure.
Right. So when we do tissue reconstruction, we almost always use tissue from the lower belly. And that just comes from the fact that, we're taking care of women in their 40s and 50s and 60s. And most of them have had children. And so they have extra tissue in the lower belly. And you just did not. And just by having Dr. Jacobs and myself, available at Stamford Hospital allowed us to do a slightly outside the box type of reconstruction where we use tissue from your inner thigh. And I think that's where it comes to, the advantages of having multiple teammates that you're very comfortable working with. And, all of us here on this call have known each other for a very long time, because it is a little bit of an outside the box option, and it is a little bit more technically complicated. By having two surgeons that are comfortable with this type of technique, I thought it was really helpful and made me comfortable that we could offer you this. And so, I'm glad you've done so well. And also, I wanted to thank you for your very kind words. You made me blush. I don't know if it's showing in my, I've got the glamour lights going over here, so I don't know if it's showing, but we appreciate you very much.
So what would you like other patients to know that are facing a breast cancer diagnosis, considering that it's October and it's Breast Cancer Awareness Month, Olivia?
Yeah, it's obviously an incredibly scary day in your life. I think it's really an isolating situation, even if you are, fortunate enough like I was to be surrounded by a great support system of just, my immediate family, but also some friends who have gone through similar situations. And so it's incredibly isolating, but I would just, let people know that of course they're not alone, and to sort of encourage them to find others who have gone through this, because the isolating factor is that no one can really understand how you're feeling in that moment unless you've kind of heard those exact words said to you. So that's why I really found a lot of comfort in speaking to friends who have gone through this, on their own cancer journeys and in various stages of it. So that was incredibly helpful to me. I think it's also much more like a mental battle in addition to it being a physical battle. So I was sort of aware of that very early on. And I think you just have to gather as much information as you can about your situation and really just advocate for yourself and trust your instincts about things. I think there are options out there, which is a great thing. And I certainly wasn't aware of course, I hadn't had to have gone through this before. So I wasn't really aware of anything until I was in that situation. For me personally, I was very much like, okay, this is great to know. This is what I want to do. Let's do it. Like I needed to very quickly get to the other side of this. I know and recognize that that's probably not the case for a lot of people. A lot of people will wait for months before they make a decision on something like this. And I was, that's just my impatient nature of just, I want to kind of get through this. So, but that's me. And so I would just say, kind of go at your own pace. Like, don't feel rushed into anything. Don't, like I said, take in as much information, use the resources that are, of your doctors and just people around you. And it's, I don't know, it's a very difficult journey, but you just have to kind of trust who you are and know what's going to work best for you, if that makes sense. It's not a very eloquent way to put it, but it's kind of what helped me significantly.
No, and I think that's very important for patients to know that you can get a recommended treatment plan, but something else may feel right, and to really advocate for yourself and say, I know that you're saying that I could do a lumpectomy, but I really feel much more comfortable with X, Y, and Z, because it's the first time many times that I'm meeting a patient and I don't know what those priorities are for that particular patient. So I totally agree with you. I always tell patients, you have to go home, you have to think about this, you have to let me know what feels right. And I think, just to go back to your point of it being so isolating, we are launching a program with Dana-Farber called Young and Strong, and you and our other patient that we interviewed tonight are definitely some of the patients that I thought about when I advocated for this program to be opened at Stanford. So it's particularly looking at patients in their 40s and what psychosocial supports we can offer them through Dana-Farber, and a lot of unique concerns for the younger patients. So it's definitely something that has been on my mind, that people like you, people like our other patient, really need more directed support, because it's not a disease of people in their 40s typically. So it is very isolating. Okay.
Yeah,
and
I feel like sorry. I was just going to add to that, in that I feel like when you were sort of talking through the lumpectomy elements, I don't even know that I'd let you finish your sentence, because I, in my mind, had sort of already jumped to like, this is what I want to do. So that just sort of underscores the idea of like, I mean, maybe not as quickly as I did, but just, again, kind of going with your instincts and what is going to feel right for you, not just in that moment, but like for me down the road, I knew that I wanted to sort of go the most extreme route so that I wouldn't have to necessarily think about this on a regular basis moving forward. So just another additive to that decision.
No, that's very helpful, because again, we can't know what a patient has already maybe even thought about, because a lot of patients have friends or family that have had breast cancer, and they say, this is what I would do if I had it. And then facing it, you might choose a different option. But a lot of patients, I do find that choose bilateral mastectomy have really thought a lot about it in preparation of a breast cancer diagnosis and feel very settled with their decision. Can you talk to us a little bit about what it was like to have drains? I know this is something that for us as physicians, we talk to patients a lot about beforehand, and then I always feel that patients give me a lot of insight to what they did, how to manage them, what they found useful, etc.
Yeah, I had been kind of given the heads up on drains from some friends who had both gone through breast surgery and also other surgeries where they needed drains. So I knew it wasn't a pleasant part of the recovery. So I sort of set my expectations around that. It definitely is not a fun part of the recovery. For me, it helped to put myself in a little bit of a routine of like, okay, I'm going to empty my drains at like these times during the day, so that I put a little bit of like structure around it. So I only had to think about it a certain number of times a day. I mean, it definitely, it's, you're again, kind of going back to that like isolated place of like, okay, I can't really go out and be around because I have X amount of drains all over my body. But I think at the same time, I tried to just embrace the fact that I could relax and recover and rest around the house. Again, I had parents, I had siblings, I had my husband and friends who were kind of offering help, not necessarily with the drains, but just for anything I needed. So I kind of embraced just being able to relax those first 2 weeks. I definitely was a little impatient in that I wanted them gone sooner than later, but it's part of the process, again, not just for breast surgery, but for a lot of different surgeries. I think just asking questions if something doesn't look or feel right. I think in a follow-up with you, Dr. Cate, I had not seen Dr. Avraham yet and was asking you if something looked normal, because again, you don't know what normal is until you're in this situation. So again, not being kind of afraid to ask about something or how this works or what's a normal amount of fluid to be coming out on a daily basis, things like that. But I will say, looking back, it does go by quickly. I mean, it's 2 weeks. And once I got through those 2 weeks, again, it put me in like another level of my recovery, like a good, a more positive place in my recovery. So it's certainly not a fun element, but I think, again, I kind of knew that going in. So there were not really a ton of surprises, I guess.
Good perspective. And if you feel comfortable, what made you choose Stamford Health for your breast cancer care?
Yeah, my OBGYN, Dr. Weinstein, is at Stamford Hospital. I've been seeing him for several years. I had my third child at Stamford Hospital. It's very close to my house. So I've always just had a really incredible experience there. And I was even, before this happened, ironically speaking to him about breast surgeons, because I was like having cysts and things like that I wanted another opinion on, and he had given me your information, Dr. Cate. So ironically, this happened a month later, but I just felt like, I think I met with you both 2 hours after my diagnosis. Like, I was able to get in very quickly. Dr. Weinstein, I think, called and helped make that happen for me. So I was incredibly grateful for that, and just in meeting with both of you felt more at ease, and again just was talked through all of the options that I had, and I trusted my gut. It felt right. I felt like I was in the best hands. I like having a hospital that's so close to home and where I've always felt comfortable. So it was a pretty easy decision for me. There wasn't really a decision. I just was like, this is where I'm going.
Thank you so much. Dr. Avraham, do you want to talk a little bit about the different types of flaps that we use for breast reconstruction? You talked a little bit about this before, but I just want patients to know what's available.
Yeah, so we love autologous reconstruction, both Dr. Jacobs and myself, and the most common donor site is the belly, which is the DIEP flap, DIEP flap. However, there are women that just don't have that option. Either they're very thin, or in proportion to the size of their breasts, or they've had surgery that precludes that option. And so we have alternative options, and those are usually from the thigh, either from the inner thigh or from the back of the thigh. And then if those aren't available, there are other options. There are options from the buttock, and there are options from the lower back, sort of from, if you'll excuse the metaphor, the love handle area that we can use, because we all have a little extra somewhere. And so there are all sorts of options. We're always looking to expand those options for patients, because it's one thing to have an in-the-box option, it's one thing to have a standard, and it's another thing to feel like we're able to empower patients when they want something that normally would not be available to them. I wanted to ask Ms. Kevstein, if it's okay, what was the experience like as a mother, do you think? Many of our patients are a little bit older than you and don't have kids at home. I was just curious what that was like.
Oh, I mean, it just adds another layer of emotion when you have young children, especially a daughter, and that's kind of the first place that your mind goes to as a mom is, how will this impact them? So it definitely was more challenging. I think I have children that range in age of understanding what this is. So, but yeah, it makes it that much more scary. But I try to also protect them from a lot of it, because they are young and don't understand, and there's just misinformation that comes out of situations. So, but it's really hard no matter what. I mean, I do think having younger children or being on the younger side, when you're facing this, it just makes it that much more of the mental challenge that I referenced earlier. Because you want to take care of yourself, but you want to take care of yourself for other people. So yeah, very, very emotional. And, but now it's like, they don't remember that I had surgery. They're like, when was that? Oh yeah, they're like, they think it's no big deal. So I guess that's probably good, the resilience of young children. But yeah, definitely very difficult and emotional with young kids.
And what would you give as advice for patients with kids who are getting autologous reconstruction for mastectomy? Because people always ask, how much help should we have? Should we have help for a week? Should we have help for 2 weeks? Should we ask, our mom or sister to come stay with us? What do you think was the right amount of time for you to have extra help around?
Yeah, I'm a pretty big control freak, so it's hard for me to sort of sit back and let other people do stuff around the house and take care of things. But I think that first week is really critical. You just need to take the time to like rest and relax your body and just even understand the magnitude of what's happened. So that first week, I definitely had my mom came and stayed with me for about 2 weeks, I think. But the first week is critical. I would say the second week, I started to try to do a few things, because you're also trying to bring a little bit of normalcy back to your life, which in my case just helped with my recovery a bit. But I would say anywhere from 1 to 2 weeks, it's really critical, so that you can, even if you're, you don't need to like be laying in bed all day, but you need to be able to have the flexibility to take time when you need it. And as most moms know, schedules are crazy. So you need to just know, okay, I'm going to go and like just be alone, or just like go take a nap or something, and you have a family member or a friend or babysitters and stuff like that around. I just think those first 2 weeks are pretty critical.
That's very helpful. Any other questions from Dr. Avraham or Dr. Jacobs?
No, I think we've covered everything. We're so happy and pleased to hear that you're doing well. This has been, emotionally and physically challenging, and we also, the natural feel and appearance of autologous reconstruction, like Dr. Avraham said, is really, what drives many women such as yourself towards using their own tissue. So we're really happy that it worked out well for you.
Thank you. Yeah, I'm happy as well. I've been in a really good place. So thanks to all of you. So I appreciate it.
Thank you so much. Thanks for sharing your story and for agreeing to participate tonight. Thank you.
Thank you, guys.